Hello everyone, my name is Yvonne Kajuju. I'm a clinical officer psychiatrist, specialized in psychiatry and also in sexual reproductive health. So I'm going to introduce you to methods of family planning. And as you can see, we have several methods of family planning, and I'll show you one by one as we go on. So the first one we're going to learn about is the pill. Most of you have heard of the pill that is usually taken every day. So we have two types of the pill. We have one that is called the progesterone only. This is the progesterone only that is given to mothers who are breastfeeding so that they don't have any shortage in milk supply. Then we have the progesterone and estrogen, that is the combined oral pill, which we have different types. And this one is taken by people who don't want to get pregnant and they are not breastfeeding. So the difference between the two is the estrogen hormone. Yes. So we have people react differently to different types of family planning, like nausea. You have issues with the breast pain. We have issues with bleeding. If you have issues with bleeding, it can reduce bleeding also for people who have issues with bleeding. So in these family planning methods, you're supposed to consult your doctor before initiating them. There are some tests they may do, checking your blood pressure, your weight, and advise you accordingly. So the other ones that we have is the injection. We have different types of injection. We have the self-injectables. We have the ones that you can come to the hospital and get injected. So we have three types of injections. We have the 1 month, we have the 2 months, and we have the 3 months. Currently, we don't have the 1 month in the market, but we have the 2 months injection. They usually varies in different types of hormones. So the 2 months injection is called nodesterant. It has a hormone that is called nodesterone, and it prevents you from getting pregnant up to 2 months. So you get an injection each and every 2 months, after every 2 months. And then we have the 3 months injection. Most of the people know it by the name of Depo, but we have other types of it. But the one that we know of is called Depo. And Depo has another variant that is called Cyanopress. Cyanopress can be given from home. You can inject yourself from home. It is ready to give. It has an injection, and you can give it by yourself from home. So there are different side effects that people can get from the injection. Most of the people complain of low libido, some issues with excessive bleeding, others low bleeding, but most of the people talk about no periods at all. So if you have issues like heavy bleeding, some doctors may prescribe you the medication so that it can reduce the bleeding. But this medication, you have to go to the hospital, consult your doctor before getting it done. So we also have other methods of family planning. We have the ones that we call condoms. Condoms, we have two types of condoms. We have the female condom and the male condom. So most of us know about the male condom, and we usually talk about the condoms having the effect of preventing you from getting sexually transmitted infections, and also they prevent you from getting pregnant also. So we usually provide something called dual protection. So most of the people have never seen the female condom. It looks like this. So basically, if you have to insert it some few minutes before having intercourse, and it can last the whole night. So you don't have to change it every time like the male condom. So it's a different version. Like the male condom usually is supposed to be inserted when you're in erect, but this one you can place it just before sex and then use it. So the other family planning method we have is the implants. We have basically two types. One is called the jadel, whereby you are inserted two rods under the skin. The dormant hand ile mkono ifanyi kazi. It is inserted and then it takes you for 5 years. And then we have the implano that is inserted one rod, whereby it takes you for 3 years. So we usually have something called a trochanter, whereby we usually put some painkiller or an anesthesia so that it can numb the area before inserting it. So we have the side effects that can happen also. With this implant, you may have issues also with libido. Some may lose their period all the way. They may have issues with either reduced weight or increased weight. And if you have symptoms like reduced weight or heavy bleeding, we usually advise you to come back to the facility and get it removed. So the implant is something very small that you can even feel from the skin. So you remove it, you can decide to remove it and then return again. If it has expired, you get it removed and then you get another one inserted again. So we have other methods like the intrauterine devices. We have different types. We have different types of intrauterine devices. So the first one in the market was called coil. You can see the way it looks like. When you insert it, it was looking like a coil. So when you insert it, it will take you 10 years before it would expire, and it prevents you from getting pregnant. So it prevents you from getting pregnant in different ways. So basically, you can see the way it looks like. This is just a model of how it looks like. So basically, we have different types, and I'm going to take you along with them. So the first thing, it acts like a barrier method. You can see the shape on it, the way it looks like. The shape, number one, it usually prevents the sperms from going to the fallopian tubes. We have some that has no copper. So the one that has copper, like this one that is called copper T, the copper in it acts as a spermicide. The sperms are usually allergic to copper. So when they get into the uterus, they usually die. So this one, the copper T, can take you up to 10 years. So the other thing that it works like is also by creating inflammation in the walls of the uterus. So it makes it an environment that cannot sustain a pregnancy. But when it moves a little bit, you may get pregnant. So you need to get it checked. So from there, we have another type. This is the hormonal version of the coil. It's called a progesterone intrauterine device. The one in the market is called Mirena. So basically, this one is given to people who have maybe allergies to copper, or people who have issues with heavy bleeding. So if patient who has heavy bleeding or issues like some types of fibroids can also be put this one, so that it can reduce period. So another thing that you need to note, the coil is also a method that can be used as an emergency contraception that is can be done before 120 hours. That is 5 days. So this one can prevent you from getting pregnant even after having sex. But you have to be really timely on that decision. So apart from that, we have another type of coil that is called a multi-load. The difference is the shape. So the multi-load is different in shape compared to the copper T or the Mirena. It's quite different. So this one, the advantage is it can be given, can be inserted even in people who have not yet given birth before. It's a little bit smaller, and the copper in it is lesser, so the side effects are a little bit lesser compared to the copper T. So the side effect you can get are like issues with bleeding, whereby it can be a little bit heavier, or The bleeding can be irregular from person to person. And we usually talk about if you have multiple partners and you're using the intrauterine device. If you're using the intrauterine device, then we talk about issues like pelvic inflammatory disease, that whereby you get an infection because it is placed inside the uterus. You can get an infection in the uterus. We call it PID. So it's something that you need to have only one partner when you are using this method. And again, we usually talk about hygiene. Hygiene is whereby you keep yourself clean. You don't have to do things like washing inside. It's not allowed. You're not supposed to wash inside there when you're using this one, because you're going to bring in infections. Yes. Then we have another method that is called the patch. The patch is also, it usually has progesterone and estrogen also. You place it anywhere except the breast. As long as it's not somewhere that it's visible, you can place it in the body. So how you use it, you start on the first day of your menstrual period, that is your day 1. You place it, change it in 7 days. So they come in threes, so you change every week. So the 4th week you usually relax, and then when your period comes, you start again afresh. But the problem with this one, the failure rate is quite high, and also the price in the market is also a little bit high. So it's a disadvantageous in that the failure rates are high. You can get pregnant with it because it can be disrupted even in some medication that we are using, and also issues with fertility is not interrupted with this one. So you can get pregnant easily. So we have another family planning method called the cycle beads, where you calculate your safe days also. So we have different colors in the cycle beads. So we have the red mark and we also have a ring. So the red mark signifies when you are starting your period. So when you start your period, you start moving the ring from the red parts. So we have the brown parts. The brown parts, when you move it, the ring there, it means you cannot get pregnant. So it signifies you are safe. So you can have sex, and then you cannot get pregnant. Then the white part shows that this is when you are ovulating, and it is easily for you to get pregnant. So from there, we also have the other brown beads, whereby it shows where you cannot get pregnant. The black part shows it depends from person to person. This is where your cycle ends, but some people have a longer cycle of up to 35 days. So it depends from person to person. Yes. So from there we have the permanent methods. We have 2 types of permanent methods. The first one for ladies, we call it bilateral tube ligation. Bilateral tube ligation means we usually tie the fallopian tubes. So by tying the fallopian tubes is where fertilization takes place. So we remove that so that when the eggs come, they cannot pass there. So there is no egg to be fertilized by the sperms. So that's something that you need to decide if you want to use it, and it's a permanent method, meaning you cannot reverse it. Then we have the vasectomy. Vasectomy is done for men, and here we usually cut the tube that is called the vas deferens, where it transports the sperms. So this we usually remove when we cut the area. We usually tie it up so that it cannot reconnect again. So if it doesn't reconnect, it means the sperms are going to only to be recycled by the body. It's not going to make someone pregnant. But that one, usually advise you to do a checkup after 3 months after procedure, so that you can know if you are fully okay or not. So I think we are done with the family planning method. So maybe we talk about the emergency pill. So the emergency pills, they're different in the market. Most of the people know of P2, Plan B. Those are the ones that are in, some also call it the postnatal. So the pill is whereby, the emergency pill is whereby it comes into 2 tablets or 4 depending on the company, so that you take it before 72 hours after having unprotected sex. And here when we talk about the emergency pill, we don't talk about using it every day because it can interfere with your cycle. And we usually give it a maximum of 2 emergency pills in 1 year. So if you are going to use it in regular times, meaning the failure rate is going to be high and you may get pregnant, or you may have a risk of something we call an ectopic pregnancy, whereby you get pregnant in the fallopian tubes. So we usually advise people, if you should not use emergency pills every time. This is only meant for emergency cases, in case of a rape case, or if you had forgotten your pill, or if you had unplanned sex that you had not planned for and you are not ready to get pregnant. That's when you use. But in a regular person, you're not supposed to use it on a daily basis or every week. You're supposed to have another long-term method. Thank you for that.